Hi, and happy Therapy Thursday. My name is Scott Gould, and I'm a certified hand therapist at the Indiana Hand to Shoulder Center. And in this video, I'm going to demonstrate one way to fabricate a dynamic wrist orthosis, L code L3905, to address extrinsic extensor tightness. Here are the materials used for this orthosis. The white material is 1/8 of an inch synergy, and the tan material is 1/8 of an inch Taylor splint. To test for extrinsic extensor tightness, passively flex the digits and wrist simultaneously. If passive wrist flexion with the digits extended is greater than with the digits flexed, extrinsic extensor tightness is present. First, you want to form the volar forearm component. Make sure the distal end of the splint is approximately 1.5 to 2 inches proximal to the wrist flexion crease. Flare the distal end to prevent median nerve compression and impingement during wear. Next, form the triangular outrigger. This should be 12 to 14 inches in length and 2 inches in width to ensure stability when rolled into a tube. After rolling the outrigger, cut 2 slits at one end of the tube, approximately 1.5 inches. Cut the first slit along the adjoining edge of splint material and the other equidistant, ensuring the 2 slits are approximately the same size. Then, form the tube into a triangle shape, securing the slits around the tube base. The angle at which your outrigger is placed will be dependent on the patient's wrist flexion. Mark the forearm component in preparation for adherence of the triangular outrigger. Next, score the volar forearm component. Then, score the bottom of the triangular outrigger. Heat the scored forearm component with the gun. Remove the triangular outrigger from the splint pan and adhere to the forearm component. Score the back of the teeth or plate component. This splint is commonly referred to as a dinosaur due to its resemblance to the prehistoric creatures. Next, score the back of the triangular outrigger component in preparation for adherence to the plate or teeth component. Remove the scored plate or teeth component from the splint pan and adhere to the triangular outrigger. Form the plates or teeth while running the splint material under cold water to help it set up. Next, place a pad at the distal end of the forearm component to ensure comfort with wear. Heat a piece of Dicem using the gun and place on the inside portion of the volar forearm component to prevent distal migration of the splint. Now you're ready for the hand component. Place the patient's arm in an upright position and have them make a fist. Using the Taylor splint, form the material over the patient's fisted hand, pinching at the index and small finger MP joints. Next, place a pad on the inside portion of the hand component where the dorsal MP joints will lie. Apply 2 Velfoam straps, one around the fingernails, keeping the hand in a full fist position, and the other around the base of the carpal bones. Next, apply a piece of Velcro with holes to the hand component that will attach rubber bands to the outrigger, thus creating stretch. Secure the forearm component to the patient's arm. Remember, the distal end should be 1.5 to 2 inches proximal to the wrist flexion crease. Check your line of pull using a goniometer. The line of pull should be 90 degrees from the metacarpals to the outrigger. And finally, last but not least, my favorite part of this particular splint, the cowabunga strap, a static Velcro strap extending from the hand component to the outrigger to provide that last little oomph of stretch. Patients just love it. That concludes this video demonstration of fabrication of a dynamic wrist orthosis to address extrinsic extensor tightness. Thanks for watching.